Hello, my name is Landon McCollum and this is Catherine Ward. We are nursing students at Bellarmine University and we're here today to talk to you about the clinical use of suboxone in the treatment of opiate dependency. Opioid addicts have basically two options as far as drugs. They can choose to use suboxone, which is a two-component drug. It has buprenorphine in it. Buprenorphine is a partial opioid agonist, and then it also has naloxone in it, which is an opioid antagonist. This drug creates a ceiling effect in which the client using it can no longer have euphoric effects and thus not become addicted to it. And it also cannot be used in conjunction with other opioids because of the presence of naloxone. On the other hand, you have methadone, which is a full opioid agonist, and this drug can be abused, and it can be used in conjunction with heroin and other opioids. So these are the two clinical options, and we want to talk to you about their use and the guidelines for it. Behind me is a graph that shows the death rate caused by overdoses of a single prescription painkiller, and on one end of the spectrum you have buprenorphine. That's very low because it's a partial opioid agonist, often used with naloxone. And then on the other end of the spectrum you have methadone. So it's just a good contrast to see there that methadone can be more dangerous depending on the patient population.
So we looked at meta-analyses that were conducted by the three institutions, and while all of them did talk about the therapeutic benefits of using suboxone, there were some interesting points that each one pointed out. So for example, Joanna Briggs pointed out that, as Landon explained, how suboxone is part buprenorphine, part naloxone. Naloxone itself actually is a teratogenic, so suboxone isn't a viable option for pregnant women seeking to avoid heroin withdrawal. We also looked at the National Guideline Clearinghouse, and they showed, their meta-analyses showed that when you put methadone and suboxone compared to each other in flexible schedules at low doses, methadone was much more effective at keeping the patients, the clients, on the treatment plan. When you made a fixed schedule, a regimented schedule, and at higher doses, they were comparable. So suboxone worked just as effectively as methadone, and like we've explained, also less risky. Also, the Cochrane database of systematic reviews, they pointed out that methadone worked better for heroin addicts or opioid addicts that had been abusing the drug for a lot longer, so over a year and at a more extreme habit of use. So suboxone was more effective than methadone, though when it was patients that had been using the drug for less than a year. And I have really quick as well a graph behind me which compares the severity of withdrawal of the three drugs, heroin, buprenorphine, and methadone. And as you can see, heroin, its severity of withdrawal compared to days since last opiate use down here. So you can see that heroin is by far the most extreme as far as withdrawal severity. Buprenorphine and methadone were comparable, but as you could tell too, buprenorphine lasted about 6 to 7 days on average, while methadone can last to over 2 weeks. So yeah, for people that are really trying to get off of heroin, buprenorphine is a really great, promising therapeutic drug. Thank you.
Thank you.